Big Medi-Cal income amount increases for 2022. Hi, I'm Kevin Knaus with InsureMeKevin.com. And the new federal poverty income amounts have been released and they are being implemented at Medi-Cal. And the income figures are up by about 5%. So that means you can earn 5% more and still qualify for Medi-Cal. A single adult can earn up to $1,564 per month and still qualify for MAGI, or Modified Adjusted Gross Income Medi-Cal. A married couple, 2 adults, can earn up to $2,106. So that's up 4.8%. On an annual basis, a single adult can earn up to $18,755, and that is up over 2021, which had a maximum income of $17,775. 2 adults in 2022 can earn up to $25,268. Now, those are the numbers to be qualified for MAGI Medi-Cal, no cost health insurance. If you are over those amounts, then you would qualify for Covered California and a health care subsidy. Now, some people don't want to be in Medi-Cal, so you need to make sure you're earning enough to be over the new numbers. And there is always an issue when the new federal poverty level income amounts come out and they're implemented in the Covered California system and the Medi-Cal system. First, during open enrollment in 2021, we came into the Covered California system for 2022 under the 2021 federal poverty levels. So if you were determined eligible for a subsidy as a single adult earning $18,000 per year, you were eligible for Covered California and the subsidies going forward. When these new numbers are implemented, a single adult, if they came in at $18,000 annually, they would be determined eligible for Medi-Cal. Now, if your income is $18,000, let's say, and you don't make any changes to your Covered California account, nothing will probably change through the year. However, if you do make a change to your Covered California account and the higher numbers have been put into the system, what happens is you can make a change as innocuous as changing an email address or a phone number, but the whole application gets run through the business rules engine of Covered California. And if your original income estimate was $18,000 as a single adult, and now the Medi-Cal eligibility is $18,755, you will be flagged for Medi-Cal. So it's very important that if you got a raise at work, the minimum wage went up, you report that to Covered California so it accurately reflects your household income. Because if you don't, you may get tripped into Medi-Cal erroneously. Now, the table of the different amounts, when you look at these on the monthly value, you're going to see all these different columns, 60%, 114, 200%. And there are many different programs in Medi-Cal that have different thresholds based on the federal poverty level. Now, one of those you may see here, 266% is outlined in green. For households with children or dependents that are 18 years old and younger, if the household income is under 266%, those dependents will go into MAGI Medi-Cal. The adults get Covered California with a subsidy, so it's always a higher amount. That's why I've outlined the two in red for adults and green for dependent children. And so you can see if you had a household of 4 individuals, 2 adults and 2 children, the household income would need to be greater than $73,815 for the children to also receive subsidies and a private health plan through Covered California. So again, we all came in under the 2021 federal poverty levels. But if we make a change in 2022 to our account and these income levels are higher, the children could inadvertently be put into Medi-Cal because possibly your income was originally estimated at, it was maybe $73,000, and that was enough for the children to have a subsidy in a private plan. But now that amount for a household of 4 is $73,815, and that would trigger Medi-Cal for the children. So we have to pay particular attention to these and make sure that the income is updated properly because people are getting raises, the minimum wage went up. So make sure you work with your agent, work with Covered California to update your income, because this is a fairly significant jump of 5%. Which will help many people. They can earn a little bit more and still stay on Medi-Cal. However, for very low income people, if they do not watch their Covered California accounts, if they're making changes and cognizant of the income, they could be tripped into Medi-Cal. So if you have any questions, it's a little bit complicated, go ahead, you can leave comments down below. You can go to my website, insuremekevin.com, and get my contact information, and I will gladly respond to you with the best answer that I can give you. All right, or just give me a phone call. Thank you so much for watching. I'm Kevin Knaus.